And welcome back to Med School Radio. This is Simon. We're going to be going over some more key associations. This review is focused on key associations. We're going to be looking at first aid, the disease/finding, and the most common or important associations. So I'm going to say the disease or finding, and then you're going to try and guess what the most common or important association is. So let's get going. Okay, the first one is mitochondrial inheritance. The disease occurs in both males and females and is inherited through females only. Next, intellectual disability, Down syndrome, Fragile X syndrome. Vitamin deficiency for the USA. Think of folate. Pregnant women who are at high risk. Body stores only 3 to 4 months supply. Prevents neural tube defects, so that's folate. Next, lysosomal storage disease, Gaucher disease or Gaucher disease. Bacterial meningitis, adults and the elderly. S. pneumoniae. Bacterial meningitis, newborns and kids. Group B, Streptococcus. E. coli, Listeria is for newborns, and for kids or teens, think of S. pneumoniae or N. meningitis. Next, HLA-DR3. Think of diabetes mellitus type 1, SLE, Graves' disease, Hashimoto thyroiditis, also associated with HLA-DR5, and Addison disease. How about HLA-DR4? Diabetes mellitus type 1, again, rheumatoid arthritis, and Addison disease. Next, bacteria associated with gastritis, peptic ulcer disease, and gastric malignancies, for example, adenocarcinoma or multoma. Think of H. pylori. How about opportunistic infection in AIDS? Pneumocystis jirovecii, pneumonia. Helminth infection for the US. Enterobius vermicularis. Viral encephalitis affecting the temporal lobe. HSV1. Infections secondary to blood transfusion. Hepatitis C. Food poisoning. Exotoxin mediated. Staph aureus or B. cereus. Osteomyelitis. Staph aureus is the most common overall. Osteomyelitis and sickle cell disease. Think of salmonella. Osteomyelitis with IV drug use. Pseudomonas, Candida, or Staph aureus. Okay, we're just looking at first aid here, looking at the rapid review section if you want to follow along, if you want to check it out yourself. Okay, next disease or finding is UTI. Think of E. coli, Staphylococcus saprophyticus for young women. Sexually transmitted disease, C. trachomatis, usually co-infected with N. gonorrhea. Next, nosocomial pneumonia, Staph aureus, Pseudomonas, and other enteric gram-negative rods. Pelvic inflammatory disease, C. trachomatis or N. gonorrhea. Infections with chronic granulomatous disease, Staph aureus, E. coli, Aspergillus, which is catalase positive. Metastases to the bone, prostate and breast would be more than the kidney, thyroid, and lung. One more time. For metastases to the bone, it would be prostate or the breast, which is seen more than kidney, thyroid, or the lung. How about metastases to the brain? Think first of the lung, then the breast, then melanoma, colon, or the kidney. Metastases to the liver. The colon is seen much more than the stomach, which is more than the pancreas. Again, metastases to the liver, colon, more than stomach, more than the pancreas. What is the S3 heart sound? Increased ventricular filling pressure, for example, mitral regurgitation or heart failure, which is common in dilated ventricles. S4 heart sound, stiff, hypertrophic ventricle, aortic stenosis, restrictive cardiomyopathy. Next, constrictive pericarditis. In the developing world, it's TB. Idiopathic viral illness is what's seen in the developed world. One more time. Constrictive pericarditis in the developing world is TB. But in the developed world, it would be idiopathic viral illness. Holosystolic murmur. Think of a VSD, tricuspid regurgitation, or mitral regurgitation. Ejection click, aortic stenosis. Mitral valve stenosis, rheumatic heart disease. Opening snap, mitral stenosis. So let's go back. Above I said ejection click is aortic stenosis. So this one is an opening snap. That's mitral stenosis. Aortic stenosis, ejection click. Mitral stenosis, opening snap. Heart murmur, congenital. Think of mitral valve prolapse. Chronic arrhythmia. Think of atrial fibrillation, which is associated with a high risk of emboli. Cyanosis, early, less common. Think of tetralogy of Fallot. Transposition of the great vessels, truncus arteriosus, total anomalous pulmonary venous return, tricuspid atresia. Next, late cyanotic shunt. Uncorrected left to right becomes right to left. This is Eisenmenger syndrome, which is caused by ASD, VSD, PDA, and results in pulmonary hypertension or polycythemia. Next, congenital cardiac anomaly, VSD. How about secondary hypertension? Think of renal artery stenosis. Chronic kidney disease, for example, polycystic kidney disease or diabetic neuropathy, and hyperaldosteronism. Next, aortic aneurysm, thoracic. Marfan syndrome, idiopathic cystic medial degeneration. Aortic aneurysm, abdominal. Atherosclerosis, smoking is the major risk factor. Aortic aneurysm, ascending or arch. Tertiary syphilis, syphilitic aortitis, can't pronounce it. Vasa vasorum destruction. Next one, sites of atherosclerosis. The abdominal aorta would be first, followed by coronary arteries, then popliteal arteries, then carotid arteries. Aortic dissection. Think of hypertension. Right heart failure due to pulmonary cause, cor pulmonale. Heart valve in bacterial endocarditis. Think of the mitral more than the aortic, which is rheumatic fever, and then tricuspid, which is due to IV drug abuse. Next, endocarditis, presentation associated with bacterium. Staph aureus, acute IVDA, tricuspid valve. Next, Viridans streptococci. Subacute, dental procedure. Next, S. bovis, colon cancer. And next, culture negative. Think of Coxiella, Bartonella, and HACEK. And lastly, temporal arteritis. Think of risk of ipsilateral blindness due to occlusion of the ophthalmic artery, polymyalgia rheumatica. Okay, so let's continue on. We're looking at the key associations with first aid. Next, recurrent inflammation, thrombosis of small or medium vessels in the extremities. This is Berger disease, also known as thromboangiitis obliterans, and it is strongly associated with tobacco. Next, cardiac primary tumor in kids. Rhabdomyoma, often seen in tuberous sclerosis. Next, cardiac tumor in adults. Metastasis, myxoma, 90% in the left atrium, called a ball valve. Congenital adrenal hyperplasia, hypotension. Think of 21-hydroxylase deficiency. Hypopituitarism. Think of pituitary adenoma, which is usually a benign tumor. Next, cretinism. Think of iodine deficit, congenital hypothyroidism. Thyroid cancer. Papillary carcinoma, childhood irradiation. Next, hypoparathyroidism. Think of accidental excision during thyroidectomy. Primary hyperparathyroidism, adenomas, hyperplasia, carcinoma. Secondary hyperparathyroidism, hypocalcemia of chronic kidney disease. How about Cushing's syndrome? The iatrogenic form is from corticosteroid therapy. Adrenocortical adenoma secretes excess cortisol. ACTH secreting pituitary adenoma is Cushing's disease, and paraneoplastic type is due to ACTH secretion by tumors. Okay, next is primary hyperaldosteronism. Think of adrenal hyperplasia or adenoma. Tumor of the adrenal medulla in kids. Neuroblastoma, this is malignant. Next, tumor of the adrenal medulla in adults. Pheochromocytoma, this is usually benign. Next, refractory peptic ulcers and high gastrin levels. Think of Zollinger-Ellison syndrome, which is a gastrinoma of the duodenum or pancreas and is associated with MEN1. Esophageal cancer, squamous cell carcinoma worldwide, and adenocarcinoma in the US. Again, esophageal cancer worldwide, think of squamous cell carcinoma, but in the US, think of adenocarcinoma. Next, acute gastric ulcer associated with CNS injury. Think of a Cushing ulcer. There's increased intracranial pressure, which stimulates vagal gastric hydrogen ions secretion. Next, acute gastric ulcer associated with severe burns. This is a curling ulcer. Greatly reduced plasma volume results in sloughing of gastric mucosa. Next, bilateral ovarian metastases from gastric carcinoma. This is Krukenberg tumor, mucin-secreting signet ring cells. Next, chronic atrophic gastritis, autoimmune. Predisposition to gastric carcinoma, and this can also cause pernicious anemia. Next, gastric cancer. Think of adenocarcinoma. Next, alternating areas of transmural inflammation and normal colon. Think of skip lesions, Crohn's disease. Site of diverticula, sigmoid colon. Diverticulum in the pharynx, Zenker diverticulum, which is diagnosed by a barium swallow. Hepatocellular carcinoma. Think of a cirrhotic liver associated with hepatitis B and C, alcoholism, and hemochromatosis. Liver disease. Think of alcoholic cirrhosis. Primary liver cancer. Think of hepatocellular carcinoma, chronic hepatitis, cirrhosis, hemochromatosis, alpha-1 antitrypsin deficiency, and Wilson disease. Okay, this is primary liver cancer, hepatocellular carcinoma. And the last one on this page is congenital conjugated hyperbilirubinemia, which is also known as a black liver. Think of Dubin-Johnson syndrome, which is inability of hepatocytes to secrete conjugated bilirubin into bile. Okay, let's move on with this. This is really excellent training. If you're preparing for the USMLE, you want to go over these in the rapid review section of first aid. So we're looking at key associations. Okay, next page starts with hereditary harmless jaundice. Think of Gilbert syndrome, which is benign congenital unconjugated hyperbilirubinemia. Next, hemochromatosis. Think of multiple blood transfusions or hereditary HFE mutation, which can result in heart failure, bronze diabetes, and an increased risk of hepatocellular carcinoma. Next, pancreatitis, acute, gallstones, alcohol. Pancreatitis chronic, alcohol in adults, and cystic fibrosis in kids. Microcytic anemia, iron deficiency, autosplenectomy, fibrosis and shrinkage. That's autosplenectomy. This is from sickle cell disease. Think of hemoglobin S. Bleeding disorder with GP1B deficiency. Bernard-Soulier syndrome, which is a defect in platelet adhesion to von Willebrand factor. Hereditary bleeding disorder, von Willebrand disease. DIC, severe sepsis, obstetric complications, cancer, burns, trauma, major surgery, acute pancreatitis, and APL. Malignancy associated with non-infectious fever, Hodgkin lymphoma. Okay, this is the type of Hodgkin's lymphoma. The next one, type of Hodgkin lymphoma. Nodular sclerosis versus mixed cellularity, lymphocytic predominance, lymphocytic depletion. Okay, what is the translocation of 1418? Follicular lymphomas, BCL2 activation, anti-apoptotic oncogene. How about 814, Burkitt lymphoma, CMYC fusion, transcription factor oncogene. Next, a type of non-Hodgkin lymphoma, diffuse large B-cell lymphoma. What is a primary bone tumor in adults? Multiple myeloma. Okay, age ranges for patients with ALL, CLL, AML, and CML. Okay, for ALL, think of a child. For CLL, think of an adult above 60. For AML, an adult up to 65, and CML is adults 45 to 85. Next one. Malignancy in kids, leukemia, brain tumors. Next, death in CML. Think of a blast crisis. Okay, 922 translocation. The Philadelphia chromosome, CML. BCR-ABL oncogene, tyrosine kinase activation, and more rarely associated with ALL. Just looking at something here. Okay, so moving on. That was the 922 translocation. Again, Philadelphia chromosome, CML, BCR-ABL oncogene, tyrosine kinase activation, more rarely associated with ALL. Next, the vertebral compression fracture. Think of osteoporosis. Type 1, postmenopausal women. Type 2, elderly man or woman. Next, HLA-B27. Think of psoriatic arthritis, ankylosing spondylitis, IBD-associated arthritis, reactive arthritis, which is formerly known as Reiter syndrome. Next, death in SLE, lupus nephropathy, a tumor of infancy, strawberry hemangioma. It grows rapidly and regresses spontaneously by childhood. Next, actinic or solar keratosis, precursor to squamous cell carcinoma. Cerebellar tonsillar herniation, Chiari-1 formation. Next, atrophy of the mammillary bodies, Wernicke encephalopathy, where there is thiamine deficiency causing ataxia, ophthalmoplegia, and confusion. Okay, let's continue on. We're looking at key associations again. This is first aid. We're looking at the last page and a bit. It's really essential that you know these by heart. Epidural hematoma. What do you think of here? Rupture of the middle meningeal artery. Trauma, lentiform shaped. Next, subdural hematoma. Rupture of bridging veins, crescent shaped. Dementia. Think of Alzheimer's disease, multiple infarcts, vascular dementia. Next, demyelinating disease in young women, multiple sclerosis. Think of a brain tumor in adults. Okay, supratentorial, metastasis, astrocytoma, including glioblastoma, multiform, and meningioma or schwannoma. Next, pituitary tumor, prolactinoma, somatotropic adenoma. Next, think of a brain tumor in kids. Infratentorial would be medulloblastoma in the cerebellum, or supratentorial craniopharyngioma. Next, mixed upper motor neurons and lower motor neuron disease. Amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis. Next, degeneration of the dorsal column fibers. Tabes dorsalis, which is tertiary syphilis. Subacute combined degeneration. Dorsal columns, lateral corticospinal, spinal cerebellar tracts are affected. Next, nephrotic syndrome in adults. Think of membranous nephropathy. Next is nephrotic syndrome in kids, minimal change disease. How about glomerulonephritis in adults? Berger disease, or IgA nephropathy. Next, kidney stones. Okay, for calcium, they are radiopaque, which means you can see them. Next, struvite or ammonium. These are radiopaque too and formed by urease-positive organisms such as Klebsiella, Proteus species, and S. saprophyticus. Next, uric acid stones are radiolucent. You can't see them. And then cysteine stones are faintly radiopaque. You can slightly see them. Next, renal tumor. Renal cell carcinoma associated with von Hippel-Lindau and cigarette smoking. Paraneoplastic syndromes, EPO, renin, PTHRP, ACTH. Next, obstruction of the male urinary tract. Think of BPH. How about primary amenorrhea? Turner syndrome, 45XO, or the mosaic type 45XO/46XX. Next, neuron migration failure. Kallmann syndrome. Hypogonadotrophic hypogonadism and anosmia. Clear cell adenocarcinoma of the vagina. DES exposure in utero. Ovarian tumor, benign, bilateral. Think of serous cystadenoma. Ovarian tumor, malignant, serous cystanocarcinoma. Okay, next, a tumor in women. Fibroids, also known as leiomyoma, which is estrogen dependent and not precancerous. What is a gynecologic malignancy? So the most common in the US is endometrial carcinoma, and most common worldwide is cervical carcinoma. Next, breast mass, fibrocytic change, carcinoma in postmenopausal women. So breast mass, you might think of fibrocystic change or carcinoma in postmenopausal women. Next, breast tumor, benign in young women. This is a fibroadenoma. How about breast cancer? What would you think of first? Invasive ductal carcinoma. And a testicular tumor. Think of a seminoma. Malignant, radiosensitive, increased placental ALP. And the last two in this section, pulmonary hypertension, idiopathic, heritable, left heart disease, for example, heart failure, lung disease, for example, COPD, hypoxemic vasoconstriction, for example, OSA, and thromboembolic, e.g., pulmonary embolism. Next, hypercoagulability, endothelial damage, blood stasis, This is Virchow's triad, which is an increased risk of thrombosis. And lastly, SIADH. Think of small cell carcinoma of the lung. So thanks very much for joining me on Med School Radio. Join me again for some more goodies. You're listening to Med School Radio.